an original.
From Story Studio Network.
I'm Tom Hoppe, and I'm your host of the Most Painful Podcast. On our last show, we spoke to Tim Solomons about research on mindfulness, ketamine, and the challenges of treating pain and PTSD. Lots of good information on that show. If you missed that episode, you can listen to it on our Spotify and Apple feed and receive notifications for the most up-to-date episodes. So on this podcast, we've talked a few times about the impact of mindset on chronic pain treatments, both from a clinician's point of view and also from a patient's point of view. Today, I'm joined by Nicholas Held, Interim Scientific Director for the Canadian Institute for Military and Veteran Health Research, who just completed a research project looking at identity and transition through physical rehab and recovery. Nick, welcome to the show.
Yeah, thank you very much for having me, Tom. I'm excited to be here. And knowing you just talked to Tim, I'm going to have to go back and listen to that one as well.
Yeah, it was a good one. It was quite interesting. They're just starting that research too, so I'm going to look forward to having it back on the show once they finish that one. So Nick, maybe just give a quick background of your role and who you were and what you're doing now and how this ties into the research you just completed.
Yeah, absolutely. Excited to. So my background is maybe like other people you've had on the show where it's not very linear necessarily. I didn't necessarily grow up thinking I'm going to do military research and that's my goal. When I first got out of university and through my master's and my PhD, during my PhD, I was more working in high performance sport and cardiovascular and exercise physiology. And at that point, I was not only doing my graduate work, but I was also the head of sports science for Field Hockey Canada. So that meant that every day I was on the field with the Olympic athletes. I was working in other settings in professional sports with things like the groups like the Toronto Raptors and the Vancouver Canucks and the Vancouver Whitecaps. And a lot of that I say because it's important, because it does actually tie in. And I know you've done a couple shows on this as well. It ties into athletes and rehab specifically. So from there, once I finished off my studies, I moved back to Kingston, Ontario. And at that point in time, I started working almost exclusively with military veterans. I joined a clinic there from a clinical standpoint, and I was able to work through my postdoctoral research as more of a clinician scientist and bring science into kind of the industry space. And chatting with veterans, what I started to realize is it was very similar to chatting with athletes. And this extends beyond just mindset and identity. It talks about transition. It talks about family life. It talks about what they expected their retirement or release to look like. It talks about how their family was so used to them being away that they've almost learned to get on without them. And coming back into that became a little bit of a challenge. And they felt like they were always getting it away. And they felt like they were going to come back into their family and be able to contribute, but that pain stopped them from being able to do that. Other key pieces, like they were so used to the stressors on the family of you get traded and you move to another city. Well, it's on the spouse and the kids to pack up and try to find a home and move. And it's the same thing in this military piece as well, where a lot of that comes on the family, the transitions and moves and things. Interesting pieces related to they're both young, right? They went from being in their institution, the old people that can't do this anymore, to all of a sudden you're 40 years old, 30 years old, and you're retired and you're released and you don't have a sense of community because you moved around a lot. And they are all of a sudden being told they're young when they were just told they're old. And they've lost this transition piece and this identity and this kind of sense of self and what they've known around them. So this transition into speaking with military veterans, primarily those living with chronic pain in a physical rehab setting, and of course comorbid mental health with that as well, became really fascinating to me because it was this identity and this sense of self and this role of physical activity that I was so comfortable with from an athletic and from a performance standpoint. I was able to explore that in my research from a physical health and mental health standpoint. So and now of course transitioning into my role, I've been with CIMVHR, the Canadian Institute for Military and Veteran Health Research, for about a year and a half in this interim scientific director role. Since then, my research has expanded to many different areas of military and veteran health, but I still have this kind of soft spot for physical rehab, identity, exercise, transition, and chronic pain.
Yeah, I mean, that sounds like quite the journey. And I think you're right. A lot of us don't kind of our paths are all over the place, but they bring us into this world. And yeah, the connection between athletes and military, it's there. I believe that too. And I know from my own standpoint, I mean, physical fitness is was huge in the military. The job required it. And so it's part of your life. And you're right. So how do you find that purpose, and how do you tie that into physical fitness at the end? So I guess when you were doing this research, maybe you can talk to us a little bit about how long was the project? What were the questions that you were trying to answer through your project?
Yeah, absolutely. So this was a multi-stage project, and it was really focused around aquatic exercise and aquatic therapy, and the use of aquatic therapy in the rehab process. And the interesting thing is the piece of the study was looking at effectiveness of aquatic exercise was one portion of it, and the other portion of it was looking at the experiences and engaging with aquatic exercise. And it really brought out a lot of key pieces for me that I thought was quite interesting into the research space. So again, talk about my performance and my sport background. A lot of this was really understanding the smallest changes that happen within the body. The mental aspect of performance was something that other people were working on. For me, I was on the pitch an hour, 2 hours, 3 hours a day, looking at all this data, making recommendations to coaches for training intensity and training volume, looking at when we should travel to world championships, looking at how we should travel. Should we stop, and should we be training in heat? Should we be training in altitude? Anything to get this performance edge. A lot of the time, I didn't spend time asking the athletes how they felt. I mean, I would from a physical exertion and stress standpoint, but not really. And I think that's changed in the sport world. But the key thing from this is when I was working one-on-one with these veterans in the study, I got to ask questions about what that meant to them to engage in that experience of aquatic exercise. And I'm excited to get into that conversation because it's not necessarily what I was expecting. And this was a challenge for me because this came from challenging what I did before. Before, I would look at any increase in exercise on a treadmill, half a mile an hour. What does that mean to that physiological response? And this side of it, it was a little bit different. I'd have these individuals in the pool tell me, well, I'm up 0.1 miles per hour compared to what I was last week. I'm actually seeing improvement. And I had to temper myself down and not say, well, from a physiological standpoint, actually, that's not improvement. They're not changing it. There's nothing there. It's kind of the same thing. I just pushed the button one extra time. But that seeing improvement that they haven't seen in so long was something so important. So to answer your question, and I can get into this a little bit deeper, what we were looking at is these individuals were in a rehabilitation program. They might have been seeing other health practitioners, athletic therapists, or massage therapists, nutritionists, whatever it might be, and they were engaging in physical rehab, both on land and in aquatic therapy. And we were interested in understanding that experiences of, from a chronic pain standpoint, of engaging in aquatic exercise. And this, we talked about pieces related to the pain itself and the experiences of pain in terms of transition from the military and exercise's role within that, and in terms of identity. So I'm happy to jump into that and talk about more pieces because, I mean, I'm completely biased, but I really enjoyed this study.
Yeah, well, I'd like to know more, like how I guess, we don't have a lot of time, so I'm not getting into the weeds of the methodology, but talking about what was it when you're talking to a veteran who's going through, say, the pool session, and you're talking about transition or identity, like what are the questions you're asking? And how are you linking that to the physical rehab, I guess would be, or maybe that wasn't the approach. I mean, what approach did you take?
Yeah, that's a good question. So the approach was not necessarily, so this is me being from a more of a clinician scientist standpoint. I'm engaging in some of these sessions. These individuals weren't necessarily working with me. And I think that's an important part of it, is that I wasn't asking these questions and then interviewing them afterwards. So they were working with other healthcare providers. And the key piece was there was a qualitative interviewing approach where I would be, after the session, they might be engaged in this rehab program, but I would be asking them questions based on their experiences. And we'd be talking almost like we're talking like this, Tom. We'd be talking about their military service. We'd be talking about exercise and physical fitness, what it's been like since they've transitioned out of the military, and this identity of being a veteran in the civilian world and what that means to them. And then we were understanding and asking some of the changes they've noticed with aquatic exercise, or how that might actually differ than their land-based exercise. Because that's kind of a key thing too, is I'm not here to suggest that aquatic exercise is better than land. I think they can actually be used in collaboration. So understanding recovery as a whole, not necessarily rehab, but recovery on this entire individual from a physical health standpoint, using land-based therapy, using aquatic therapy, and the differences in that approach allows us to really kind of understand, like, what are the key pieces for this individual, and how can we use these different approaches to create a plan for recovery, which tends to use a lot of these more kind of psychologically based pieces like identity and sense of self and the purpose. Mm-hmm. And I think that's really important. me as an exercise professional, healthcare provider, whatever it means, I tell you to do an exercise, and I'm going to tell you about the contractions, the strength, the hope we gain from it from a physical perspective. But it's important to also ask you, what you're getting out of it. What do you think? Like, what does that mean to you to do that exercise? Now, we don't do that for every single one, but I think it's a key piece to understand what that means. And you can use a squat example. Sure, you're increasing lower body strength. You might be increasing some kind of coordination, whatever it might be. But to that individual that says, wow, I can feel myself being able to get out of bed and transfer to a wheelchair, or whatever that might be for independent living, that exercise needs something more. And I enjoy this podcast, so I've listened to this a few times, and we talk about pain scales, and I think pain scales have a place, subjective pain scales that can be used. But it was always interesting me how qualitative research doesn't end up in more pain research, and it's starting to now. But I'd ask these individuals about, when you walk up the stairs, what's your pain? And they'd tell me the story, like, when I walk up the stairs, I feel this pain in my knee, and it makes me think, my knee's going to give out. And what if I fall on these stairs? And what would that mean for looking after my children, or my financials? Would I have to take off time off work, and all of these things come into their mind. And then I sit there and go, so is that a 4 out of 10, would you say, or a 5 out of 10? And this qualitative piece has such an important part of that to understand meaning behind exercise and physical activity.
Yeah, and even if you talk, as you're talking about, I mean, there's a couple questions that come out of that pop in my mind, but just even something as simple as scores, we know that because of the military, and I'm broad brushing, everybody is different, but in general, military people will tend to push through their, say, my pain's maybe like a 2 when it's actually a 7, right? It's just, and so, how does that translate to in the civilian world, where someone who doesn't understand that culture and saying, oh, you only got a 2, so you must be fine, right? So we'll adjust our training differently, and then the person hurts more. But how are you linking, and how are you tying in, be it aquatic therapy or land-based therapy, how are you tying that into the identity and the transition? So I'm trying to make that link, so maybe you can help me.
Yeah, I can speak more specifically to that. So one thing that came across in a lot of these interviews is that exercise is tied to many different military individuals. And it's tied to being able to do things like running specifically, which was a fascinating thing, where like military and running are so linked together. People transitioning from the military saying, I don't know how to exercise. What they're saying is, I can't run anymore, and I can't rucksack march, so I don't know what to do. So a big part of it was this: being in the military meant to them that they were physically capable and they were physically fit to some capacity. And being physically fit was a key piece to their identity. Now, when you get into a land-based setting, we would ask questions related to land-based exercise. And if somebody would tell them to do 10 reps and they can only do 8, well, that has an impact on how they're feeling. They weren't able to achieve that mission or that goal or whatever it might be of what you asked them to do. Whereas in the water, this was a significant piece. So these pools had an underwater treadmill, which is different than what other therapy pools might have. But a key piece is that they were able to run, something that they never thought they would be able to do before, something that they remembered doing. And it was a link back to many, many memories of being within the military. So just being able to run again was a significant reminder of their kind of identity and their sense of self. Being able to ask them to do an extra, like 10 squats or 20 squats, whatever it might be, and them to being able to complete that and maybe do more is a big piece of their identity, of that training, and that being able to, like, so that you tell somebody to jump and they say how high, you tell them to do 10, they could do 12 or 15 if they wanted. And that was kind of this big piece of being physically fit. And so that was a reminder of that military experience that they had, is that they saw themselves again as being more physically fit individuals that are able to accomplish and see a sense of accomplishment that they hadn't felt in a long time.
Yeah, so it's tying into that mission and purpose, basically, right? Is what it's happening. And then because I know you probably know that research. I think it was out of DeGroote, where they looked at the comparison between veterans and civilians in a pain clinic, where they do very well because it's structured. But I do know that we've heard from some veterans 3 months after, when they're out, or 4 months after, whatever the timeline is, when they're out of that clinic and they're back on their own and they don't have that sense of purpose, in a sense, they end up sitting on the couch and they start having pain again. So I guess the question I have for you is, were you able to determine how to keep that going for somebody. So if somebody is improving with their exercises, it's giving them that kind of sense of purpose or strength because they're able to do it. What are the tools to ensure that that has longevity? That it is a behavioral change. Were you able to, at this point, did your project look at that? Were you able to look at that?
No, we didn't measure that specifically, and that's a phase that we would like to do. And I think we did talk a little bit about seeing this provides hope for the future, right? To be able to do something you thought that you couldn't is a powerful tool that allows you to stay motivated. There's a lot of things where I've worked with veterans who, when they have a goal in mind, it's amazing what they can accomplish. When they have that mission, when they have that purpose that they're aiming for, and the Alpine Challenge would be an example of that. Working with people before they were selected versus when they were selected for the Alpine Challenge was a whole different experience of somebody who now has a goal and a purpose in mind. Now, I think another key piece that we did touch on in this study, which is important, doesn't quite answer the question, but it was related to pain. And so in the water, they felt a reduction in pain during the session. I still think that's important. Oftentimes when we're looking at interventional chronic pain, we talk about whether this is a lasting effect, which is the goal. And I recognize the importance of that. But to somebody who's living with chronic pain, they will take that kind of acute, that short period of time where they get the pain is either lower or removed. So that was a key piece to when they engaged in aquatic exercise. They felt during the session, the pain was relieved. They also felt that after the session, we had people saying that compared to land, they felt that pain was reduced for a period of 24, 72 hours. So a period of 2 to 3 weeks, or some people saying week to week. They felt like they could do more things, they could last longer. Now, this is looking at chronic pain in a silo. What that meant for a lot of people was that I was able to book an appointment or book time with a friend or go out to a sporting event and not cancel. And they would book those after their aquatic therapy because they knew, mindset or physically, 24 or 48 hours, they'd be okay to do that. But after a land session, they had to completely reorganize their schedule and they felt like they wouldn't be able to engage in that event. Now, there could be some physical pieces to this. There could be some mental, placebo, psychological pieces. But the key is when you're organizing your whole life around your therapy, that's a significant thing. And then you're able to go out and engage a bit more. The other thing that a lot of people discussed is the ability to have a conversation without thinking about the pain constantly. And I think that's another piece that's so important is during these sessions, they reported that because the pain was lower, they could think. They haven't been able to think clearly. They hadn't been able to speak clearly, to hold a conversation. They couldn't follow it because they were always thinking about the pain. It was always there. So while there's more work to be done to understand the characteristics that lead to longer lasting pain, I think it's also important that we look for these individuals and for their physical and mental health, the importance, and for their social health too, the importance of during the session pain reduction, especially when it's paired with something like exercise that brings out the sense of identity, purpose, accomplishment, reclaiming a sense of self and providing hope for what they could have physically looked like in the future. The idea that if I can do this in the pool, I can't do it on land today, but I know that I can do it on land at some point in time because I'm doing it right now in the water. That's different than I can't do it on land. I'll probably never be able to do it again in terms of motivation.
Yeah, and I mean it's a mindset change, right? It's it's pushing through and not pushing through, but understanding that that is okay. It's fine because I mean, and once again, I'm broad brushing. Everybody's different, but I know that some veterans will push hard, as you probably know. You've worked with them, and they don't understand what the word pacing is. I say it all the time on this show. I jokingly, when someone told me pacing, I thought someone's going to run beside me. I had no idea what it was, right?
Yeah, exactly.
Because that's not, you just do it, you push. So when I 100% get what you're saying is that when a person can't achieve the 20 squats or running 5K, it's a letdown. They feel that they failed. So it's changing that mindset to say, that's okay. Maybe you only did 3 today. That's good. You only did 3K, but you still achieved something, right? It's that. So what we found, a lot of veterans have no understanding of pain science. So during your research,
Absolutely.
did any of that come up as a, were there veterans who say had gone to an interdisciplinary pain clinic where they have education and rehab tied together? Did you notice a difference with their mindset compared to somebody who had no pain science knowledge, or were there even any veterans that you that were in this research project that even had pain science knowledge?
Yeah, that's a good question. I'm not. I'd have to go back to understand if there were people who had formal pain science education. One thing that we ended up doing was at the clinic that this study was run through was offering at least some in some capacity pain neuroscience education to understand a little bit about what chronic pain is, to understand that it is viewed from more of a biopsychosocial perspective. So I think there was that awareness. The challenge is sometimes believing that, I think, is a challenging thing. It was also very fascinating to me during those sessions. So we would book a complete hour just to sit down with the individual, learn a little bit about them, educate them on what chronic pain is to try to set them up for success within the program. Now, I was amazed many times where I think this is where experience within the military, experiences within that kind of culture leaks into veteran kind of intervention and therapy. You would talk to these individuals, you explain a little bit about chronic pain, you explain a bit about the nervous system, the responses of the brain. And as soon as you kind of brought up this idea, you were trying to let them know that it's not all this like this physical piece. There's no injury at like the knee, let's say. And then immediately you get this section saying, so you're telling me it's all in my head. And they've heard that before. And like, no, we're not saying like the pain is real, whether it's physical, whether it's whatever it might be, that pain that you're experiencing is real. But it was interesting to see. So I think that the individuals who have engaged in neuroeducation is critical to understand chronic pain. But I think a lot of like a key theme I'm seeing in this as well in this conversation is it's important to understand a little bit about the perspectives of a healthcare provider and the conversations they're having and how they're engaging in this recovery process, but also that interpretation from the veteran side of things as well, because we don't have the same experience as many of the times. And that's kind of a key piece to it.
Yeah, I know. And as you're talking about it, I'm thinking, yeah, it's all in my head. I mean, and that's part of that culture. So, like we know, through our research and when I talk to veterans, I say to them, the civilian world hasn't changed. You've changed. So, what can we draw on? What are the strengths that you can draw on from that, and what's different? And so, as you're talking, I'm wondering, so you got the pain science talking about that, but then also perhaps this type of education is important for them too, because it comes down to awareness. And I think, we've changed in ways that we aren't even aware of. It's become normal for us. And I think, I don't know if you and I have talked about this, but I use a very simple thing about time. I'm sure as a clinician, how early are veterans when they show up to an appointment? They're fairly early.
Absolutely.
And I just had an interview with for this year for the hike with a veteran, and he had talked about this too. Is something like time, there's a severe consequence to it in the military. So from a young age, if that's bred into you, it becomes normal that if you're late, you have this physical reaction and may not even understand it, why you're having this physical reaction until someone brings awareness to it. So having said that, I'm wondering, is that also a key component to part of this rehab and identity, is to bring that awareness to how people have changed because they don't know what they don't know. I include myself. I mean, every day I'm learning something new, and I've been doing this for 20 years. So, I just kind of throw that out, not as a question, but maybe more of as a discussion, like.
I was in a conversation the other day, almost identical. I'll say two pieces if you don't mind there, Tom.
Yeah.
One is this idea. I've always been fascinated with this idea at the clinic that I was working at, was this idea of a waiting room, which typically you don't want in healthcare. You take people, you put them in a room, they wait for the physician, whoever it might be, and you don't have this crowded waiting room. I actually think a lot of the success of this program that we were offering was that people came in 15 minutes early, and they said, "Hi, I remember you from basic training in 1998. And it creates this sense of trust, that the sense of this is going to work, this sense of if other people are doing it and getting benefits, I must too. And it's a whole different piece. So this idea of a waiting room was something we embraced, a busy waiting room. Yeah, maybe there you might have to wait a bit longer for your session or whatever it might be. But we had people saying, like, can I finish this conversation, then go start my warm-up, which is very important just to get people to the clinic. The other piece that I wanted to touch on is the education for veterans. And I use something like cultural competency. We talk to veterans who say within 60, 90 seconds, 2 minutes, they can identify whether the practitioner they're talking about knows anything about the military. that has an impact on treatment efficacy and effectiveness if that provider has a background within the military, at least in some capacity, not physically themselves, but maybe having an understanding of it. So we then go to the healthcare providers and we educate them on what the military is and gives them some understanding about it to try to enhance treatment and therapy. But I think there's another key piece there where there could be some work done to educate veterans on this identity and this culture to understand how therapy and treatment could be different for them or could be changed for them or they could contribute to a bit more. And I think that's something of educating veterans a little bit and creating some awareness around how they are different than the civilian population. And not to say that's you're not trying to say you're different, but this idea that healthcare and them vocalizing their identity, that they're vocalizing their time in the military and sharing some of those experiences could have a huge impact on therapy. So I don't think we've gotten there yet. And I think another key piece that ties into is this idea of identity. And a critical point is that I've spoken to many veterans who you ask them if they're they talk about being in the military and they're not military members anymore. You ask them if they're veterans, you're not asking them if they're veterans, but you talk about being a veteran. They're not a veteran anymore, or they don't see themselves as a veteran because they didn't serve in World War I and World War II. They don't feel like a civilian, so they definitely wouldn't identify like that. So now you're like, where do you fit into this world if you're not a civilian, of military, or a veteran? And I think that extends more to the personal individual identity. But if I'm not feeling that, then am I really identifying myself in healthcare as a veteran? And if I'm not getting the resources and the tools that are being developed for me because I'm not seeking them out because I don't know why being a veteran is important. Why do I need to identify myself as that if I don't feel it? And therefore, I'm not getting access to these great tools that are being developed. So there's a much bigger piece to that I think we can work on that educates the healthcare providers, but also doesn't assume that every veteran is the same and knows exactly what they need and to look for.
And that's exactly when you said, the healthcare provider has to be educated. The first thing that came to my mind is, well, so does a veteran. It's not all on the healthcare. This is a two-way street here. And and we've done that with clinics like out here with Change Pain. We've done that. You've done it with yourself. Hydro Athletics does great stuff in Kingston. And so does DeGroot. So it is happening, but I think you're right. The veteran needs it too. And that's what we're trying to do with the Alpine Hike, really, was to provide that knowledge in dribs and drabs. We can't, of course, do a full course, but at least to start somewhere and hopefully to improve it as we move down the road. So, Nick, I could talk for a lot longer. I'd just love to pick your brain more, but we got to wrap up. So I really appreciate you being on the show and sharing the insights of that research.
Yeah, thank you for having me, Tom. I'm happy to come back anytime. Well,
I think we might have to do that. So, and for our audience, for feedback about the show or more information on chronic pain, you can visit our website, veteranschronicpain.ca, or follow us on Facebook and X at Chronic Pain COE, and on Instagram at chronicpain_COE. And for everybody, stay safe and keep the hope alive.
The Most Painful Podcast is produced for the Chronic Pain Center of Excellence by Story Studio Network.